Imagine this. You have two very different paths in front of you. On the left, there is a weekly injection. You take a small pen, push a button once a week, and the scale begins to move. That is a drug like Ozempic. On the right, there is no drug at all. You drink water, black coffee, maybe some tea. You do not eat for part of the day. Your body starts to burn stored fat and may even repair some damage inside. That is fasting, the method explained by doctors like Jason. Which path gives you better health? In 10 years? Which one protects your body, your wallet, and your future? And can they even be compared fairly? If you want honest answers and not just a sales pitch from a drug ad, stay with me to the end. You might change the way you look at weight loss forever. Before we go on, if you care about real health, not quick tricks, make sure you subscribe to Core Health right now. Turn on the bell so you do not miss any new videos. That really helps this channel grow and helps more people find the truth about fasting and metabolic health. Now, let us dive in. First, we need to understand what is really going wrong in the body when weight goes up and will not come down. Most people are told the same simple story. Eat less, move more. Eat fewer calories. Run on a treadmill. If you do not lose weight, you must be weak or lazy. But you and I know that is not true. Many people have tried calorie cutting again and again. They lose 5 kilos, then they gain 7 back. The problem is deeper. It is not just about how much you eat. It is about hormones, especially a hormone called insulin. Insulin is like a key that lets sugar from your blood into your cells. When insulin is low, your body can unlock fat cells and burn stored energy. When insulin is high all the time, your body keeps holding on to fat and keeps asking for more food. This state is called insulin resistance. So the insulin resistance is the real root cause for many cases of obesity, type 2 diabetes, fatty liver, and even some heart problems. So if a treatment does not fix insulin resistance, it may give short-term results, but not real long-term healing. Now, where does Ozempic fit in this story? Ozempic is a brand name for a drug called semaglutide. It is a GLP-1 agonist. That sounds complex, but we can keep it simple. GLP-1 is a hormone your body already makes in your gut. It helps your brain feel full. It slows how fast your stomach empties, and it helps control blood sugar. Drugs like Ozempic copy this hormone. When you inject it once a week, many people feel less hungry. They feel full faster. They may think about food less. Some people say it is the first time in their lives they are not constantly obsessed with eating. This can lead to real and often large weight loss. In studies, people can lose a lot of weight in 1 or 2 years. So on the surface, Ozempic looks like a dream. You inject, you eat less, you lose weight. You do not have to change your lifestyle, your meals, or your daily habits very much. You do not even have to skip breakfast or dinner. That is part of why it is so popular in places like the United States, the United Kingdom, Europe, and Australia. But here is the question we must ask. Is Ozempic fixing the root cause, or is it using a clever trick to push the problem away for a while? Think about what actually happens. On Ozempic, many people eat fewer calories because they feel full. Less food means less sugar and less demand for insulin. So their blood sugar and weight can drop. That looks wonderful, but the body is still in the same basic pattern. 3 meals a day or more. Snacks, constant feeding, insulin is still coming out many times a day. Just maybe a bit less because total food is less. When a person stops the drug, what happens? In many cases, hunger comes back, old habits return, and the weight often begins to climb again. Not for everyone, but for many people. This shows us that in a lot of cases, Ozempic is controlling appetite from the outside, not healing the underlying system that controls hunger from the inside. Now let us put Ozempic to one side for a moment and look at fasting. Fasting is very simple. It is not eating for a set period of time. You already do a short fast every night when you sleep. Intermittent fasting is just making that fasting window longer on purpose. Maybe you skip breakfast and eat your first meal at noon. Then you stop eating again in the evening. Maybe you eat in an 8-hour or 6-hour window and you fast the rest of the day. There are also longer fasts like 24 hours, 36 hours, or more, but always with proper guidance and care. During fasting, insulin levels fall low. When insulin is low for long enough, your body can open the doors to your fat cells. So it can start burning your stored fat for fuel. Over time, your body can start to reverse insulin resistance instead of just working around it. This is why fasting uses as a tool to help people with type 2 diabetes, obesity, and fatty liver. Here is one big difference. With fasting, you are not adding something from outside. You are using a natural switch that is already inside your body. You are training your hormones and your metabolism to work the way they are meant to work. You are teaching your body that it can live off stored energy, not just fresh food. Of course, fasting is not easy at first. Hunger can be strong when you start. You may feel tired or anxious in the first days, but your body learns. Your hunger hormones adjust. Many people find that after a week or two, fasting actually feels easier than constant snacking. They feel more stable energy and clearer thinking. So now we have two tools: Ozempic, which lowers hunger by using a drug that copies a gut hormone, and fasting, which lowers insulin and trains the body to burn stored fat. The main problem we are trying to solve is the same: high body weight, insulin resistance, type 2 diabetes risk, poor energy, a body that seems stuck. To understand which tool may be better for you, we need to compare them in a few important areas: results, cost, safety, side effects, and long-term change. Let us start with results. Drugs like Ozempic can give fast and often very large weight loss. Many people lose 10, 15, or even 20% of their body weight. That can feel life-changing. Clothes fit better, joints hurt less. Blood sugar may improve. Some people can reduce other diabetes medicines under a doctor's guidance. For someone in real danger from their weight, the speed can be a blessing. Fasting can also give strong results, but they may be slower and depend a lot on how you do it. If you just skip breakfast and still eat junk food later, results may be limited. If you combine fasting with better food choices like whole foods, fewer refined sugars, and more real fats and protein, the effect can be deep. Many people lose large amounts of weight and even put type 2 diabetes into remission. The second area is cost. Ozempic and similar drugs are expensive. In some countries, health insurance will pay, but often only if you have type 2 diabetes or very high body mass index. In many cases, patients have to pay a lot each month. Over years, that can be many thousands in cost. If you stop the drug because of money, your results may disappear. Fasting, on the other hand, is almost free. You may even save money because you buy less food. You might invest in a book, an online program, or maybe some lab tests, but the core tool itself, not eating for part of the day, costs nothing. This makes fasting very powerful for people who cannot pay for new drugs or who do not want to depend on a prescription. The next area is safety and side effects. No drug is free from side effects. Common side effects for Ozempic can include nausea, vomiting, diarrhea, constipation, and stomach pain. Some people also report tiredness, mood changes, or feeling weak. There are rare but serious risks that doctors watch for, such as certain pancreas or gallbladder problems. For most people, the side effects are mild to moderate and may improve over time, but for some, they are strong enough to stop the drug. Fasting also has side effects, especially at the start. You may feel hungry, lightheaded, or get headaches. Some people feel irritable. If you have low blood sugar or take certain medicines, fasting can be dangerous if done without a doctor. Pregnant women, children, and some people with eating disorders should not fast in the same way. So fasting is simple, but it still must be done with care, knowledge, and sometimes medical advice. Here's a key difference though. With a drug, the side effects come from something new you are putting into your body. With fasting, the effects come from allowing your body to use its own systems. Many people feel that fasting side effects get better as their body adapts. And when you stop fasting and go back to normal meals, most side effects end quickly. Now, the most important question: which one actually fixes the root cause? Ozempic lowers appetite and can lower blood sugar. It is like turning down the volume on hunger, but does it repair insulin resistance in a deep way? There's some early research that suggests that weight loss from these drugs can improve insulin sensitivity. So some healing does happen. But remember, if the drug is stopped and weight comes back, the gains can be lost. Fasting goes directly at the root cause by lowering insulin levels many hours each day. It gives your body time when no food is coming in and no insulin is needed. Over time, this can train your cells to respond better to insulin. It can reduce stored fat in the liver and belly. It can reshape your metabolism from sugar burning to fat burning. This is why doctors like Jason Fung say that fasting can reverse type 2 diabetes in some patients, not just control it. You might be thinking this sounds great, but fasting sounds hard for me. And Ozempic sounds scary or expensive. So what should I actually do? First, remember, this is not medical advice. I am not your personal doctor. I am sharing information and ideas. Always talk to your own doctor, especially if you take medicines for blood sugar, blood pressure, or mood. With that said, let us talk about real life choices. Maybe you are someone who has tried every diet. You have counted calories, points, carbs. You feel your hunger is out of control. Food is on your mind all day. You've tried short fasts and it just felt impossible. For you, Ozempic might be a tool to break the cycle. It can quiet the noise so you can start building better habits without fighting constant cravings. But here's the key. If you choose a drug like Ozempic, use the time on the drug to also change your lifestyle. Learn about fasting, learn about lower carb or real food eating. Practice having clear eating windows even while you are on the medicine. If you just rely on the needle and change nothing else, it is very likely that when the drug stops, the weight will come back. On the other hand, maybe drugs scare you. You prefer natural methods. You like the idea of your body healing itself. You are willing to feel some discomfort for a deeper change. In that case, starting with fasting makes a lot of sense. Begin with a simple daily fast of 12 to 14 hours, then move up to 16 hours. Combine it with better food. Use the kind of methods Dr. Jason Fung teaches, like not snacking all day, and focusing on real meals. Whichever path you lean toward, remember you are not weak for needing help. Your hormones and your food environment make weight loss very hard. The modern world is full of cheap, ultra-processed food. Screens and ads push you to eat every hour. In this world, tools like fasting and even drugs can be seen as ways to protect yourself. The question is, which tool fits your values and your body? Let us take a short pause here. If you are getting value from this video and you want more honest talks about fasting, weight loss, and real health, please hit that subscribe button for Core Health right now. Like this video so it reaches more people and share it with a friend or family member who is thinking about Ozempic or fasting and does not know what to do. Your support really helps this channel grow. Now, let us go even deeper because there is another big question: sustainability. Can you see yourself doing this for years? Think about Ozempic as a lifelong plan. Are you ready to inject every week? Maybe for many years. Are you ready for the cost? Are you ready for possible side effects that may come and go? If yes, and if your doctor agrees that the benefits are bigger than the risks, then Ozempic can be part of a long-term strategy. But if you know you will not want to stay on a drug forever, then sooner or later you must build habits that work without it. Fasting is different. You can change your fasting pattern over time. Maybe in the beginning you do 16 hours every day. Later, when your weight is better, you might only fast that way a few days a week. You might do an occasional 24-hour fast after holidays. Fasting is flexible. You can adjust it to your job, your family, and your culture. You are not locked into one fixed dose from a pharmacy. There's also the question of what fasting and Ozempic do to your mind and your relationship with food. Some people on Ozempic report that food becomes boring, they feel no joy from eating. For a short time, this might be useful. It can break addictive patterns. But if this goes on for years, some people feel sad or disconnected from social meals. They might feel they lost a part of their culture or pleasure. For others, it is a relief and they are happy. People are different. Fasting, when done wisely, can actually improve your joy with food. Many people say that after a fast, They enjoy their meals more, not less. Real food tastes better. They feel grateful instead of guilty when they eat. Of course, fasting can also trigger old diet trauma or fear around food in some people. So it is important to approach it gently with self-respect, not as a punishment. So where does all this leave us? If we put everything together, we might say it like this. Drugs like Ozempic can be powerful tools, especially for people with very high medical risk who need big, fast weight loss and who have tried many other methods. But they are often best used as a bridge, not as the whole road, a bridge from a very dangerous place to a safer place. The real road is built with habits, with understanding hormones, with food choices, and very often with fasting. Fasting is a tool that works with your own biology. It aims to correct insulin resistance, not just lower the number on the scale for a while. It is cheap, simple, and flexible, but it requires learning, patience, and support. There is no company making billions from it, so you will not see huge ads for it on television. You have to seek it out yourself. Maybe the most honest answer to Ozempic versus fasting is not that one is always better than the other. It is that you need a plan that looks at the whole picture, your health history, your money, your level of risk, your willingness to change your daily life, your values about medicine and natural methods. For some people, the best plan might be to start fasting and real food right now and never touch drugs like Ozempic. For others, the best plan might be to use Ozempic for a season while also learning fasting, then slowly step away from the drug under a doctor's care. For almost no one is the best plan to only inject a drug and never change anything else. As you think about your own next step, ask yourself a few simple questions. Do I want a quick fix? Or do I want deep change, even if it is slower? Am I willing to feel some discomfort now to avoid bigger problems later? Can I see myself using this method 5 years from now? 10 years from now? Am I working with the doctor who understands metabolic health and not just calorie math? If your answers point toward deeper change, fasting is one of the most powerful tools you can learn. You do not have to be perfect. You just have to start. Maybe that start is simply delaying breakfast by 1 hour tomorrow. As we wrap up, remember this. You are not broken. Your body is doing its best with the signals you give it. If you feed it 6 times a day, it will stay in storage mode. If you never let insulin rest, it will protect fat stores. But if you give your body time without food and you lower insulin, you give it a chance to burn fat and heal. That is the promise of fasting. Ozempic and similar drugs can help some people change those signals from the outside. Fasting can help you change them from the inside. The choice is not simple, but now you have a clearer view. If you learned something new today, please subscribe to Core Health if you have not already. Click like and share this video with someone who is thinking about getting on Ozempic or who feels stuck with their weight. Your one small action might give them the information they need to make a safer, wiser choice. Thank you for watching. Take care of your body. Take care of your mind. And I will see you in the next video, where we will go even deeper into fasting and real metabolic healing.